not, sorry, you guys. Two of the nursing homes selected for the audit was found to have allowed resident care by a non-licensed staff prior to having a statewide criminal background check completed. Fourth, the state, as a state agency, we did not routinely review employee files to monitor criminal background checks to ensure compliance with federal and state regulations. And last but not least, some sampled nursing homes did not have certified written assurances from staffing agencies that statewide criminal background checks for those contracted non-licensed staff had been conducted. So I send a memo out. We sent a memo out, Health Standards did, on December 7th with all these findings and our responses on how we were going to address these issues. Along with that memo, we sent attachments of the authorized agencies, a list of federal and state requirements, and lastly, we sent an attestation for a self-audit to be completed by the nursing homes within 90 days of this training. The due date to have this completed is April 27th. We appreciate all of you who started work on this already and have already submitted your self-audit and attestations. I will now turn the training over to Barry Sepp and Michelle Lewis. Thank you.
Hi, this is Mary Sepp. And I will start off with the background checks and screening. Okay, the Louisiana Medicaid program. You know, as a condition of participation in the Louisiana Medicaid program, providers are responsible for ensuring current and potential employees, contractors, and other agents and affiliates have not been excluded from participating in Medicaid or Medicare programs by Louisiana Medicaid or Department of Health and Human Services Office of Inspector General. Providers who employ or contract with excluded individuals or entities may be subject to penalties of $10,000 for each item of service the excluded individual has furnished. Okay, and when we do the checks, it was the system for awarded management, and we had the Department of Health and Human Services Office of Inspector General. Okay, the SAMs was for the entities, the exclusion, OIG exclusion was for the individuals at the facility. But now we have the adverse action site. The adverse actions website database is to be looked at upon hire and monthly thereafter for individuals and entities that have adverse actions imposed. This is a user-friendly site that allows single and multiple searches for individuals and entities. You can use this site, and this site has the individuals and the entities on it. Not like the separate sites as the SAMs and the OIG by itself. Okay, and when the providers do these searches for the adverse action on the adverse action site, they have to provide proof, they have to maintain proof that they did these searches. And you can do it by just printing out the results of the search, because on that page, it has the date. And when surveyors come out, they can look at that and see that that is a part of what date that you did these searches. Okay. And for the background checks, effective June 2nd, 2016, Act 311 amended the LS 41-2003 1 through 2, requiring that licensed healthcare providers shall request that criminal history checks and security checks are conducted on non-licensed personnel prior to an employee making or to contract with a non-licensed person or licensed ambulance personnel to provide nursing care, health-related services, medic service, or supportive assistance to any individual. Okay, and now we're talking about the criminal background checks. Before, for the Medicaid participation, you had to check the adverse action. Okay, now we have to check the criminal background check with the state police. Okay, and in requesting the criminal background check is three ways to do it with the Bureau International Background Check website. That's where you have to register and be able to look at that site. Okay, most of our nursing home and licensed facilities use authorized agents to do the work and to look up these backgrounds. Okay, and the third way is submissions of the applicant's fingerprints. Employees and authorized agencies may establish accounts, like I was saying, with the Bureau, which is the web application for name-based criminal background checks. Okay, authorized agency must be domiciled in the state of Louisiana, and it must be certified by the Louisiana Secretary of State's office. Authorized agents must also be certified by the Bureau. Companies that perform background check services that are not domiciled in Louisiana nor certified through the Secretary of State office or Bureau are not authorized to request criminal background checks. Okay, so I know we've had a few issues with nursing homes contracting with authorized agencies, and authorized agencies then subcontracting that with other agencies that are not authorized by the state. And this, and you can't do this. This is not allowed. We can only, if a nursing home contracts with the authorized agency to do their background checks, that agency has to do the background checks. And the office, they must have a domicile in Louisiana. And like I was saying, the Louisiana Office of State Police Bureau of Criminal Investigation, Identification, and Information is the state designated repository for criminal history information. Any criminal event that is documented by the submission of fingerprints to the state is stored here. The Bureau may only release this history information stored for non criminal justice purposes when authorized by law. Okay, at one time we had where offenses that employees were convicted of were able to be waived. Now we do not have any exclusionary conviction that can be waived. They are not waived. If you have a conviction of one of the exclusionary crimes, you would not be able to work. Okay, and once you receive your criminal background check from your authorized agency, you may have on there where you have a charge but when excluding from when it's being excluded from working, you have to be convicted of a crime. Being charged and being convicted are different. Excuse me. A charge is a formal accusing of an offense, which is the preliminary step for prosecution. So you can be charged with something, but you may not be convicted of it. And if you are convicted of it, you cannot work. That's what you have to look at. And you got to look at the disposition. That's the court's final determination of the cases it are issued. So if you have to look at the disposition, because somebody someone may be charged with a certain crime, but in the disposition, you see that they have been convicted of a lesser crime that is not on the exclusionary rule, so that person would be able to work. So you have to make sure they have a disposition, because sometimes in a disposition you may even have where they dismiss the case, or they chose not to prosecute, and this is going to be in the disposition. If they do not have a disposition, they are to go to the clerk of court, and at the clerk of court they can receive the disposition on any conviction. Okay. If When the surveyors go out and there is no disposition, it is assumed that that person was convicted, because we need to know what was the final disposition of that conviction. Okay, and I have some exclusionary codes that are on here. These are just the ones, and if a person has been convicted of one of these codes, they will not be able to work. We have, it's like 4 extra codes that a person cannot have if they are working with clients under the age of 21. And we have the codes for drug codes: to produce, manufacture, distribute, or dispense, or possess with intent to produce, manufacture, distribute, or dispense a controlled dangerous substance. So if they have a conviction of producing, manufacturing, distributing of drugs, they cannot be hired. They cannot be hired. This is an exclusionary code. Okay. Attempt or conspiracy to commit one of these codes that bar employment also bars that person from being hired. Per se, attempted murder, principal to murder. If you are convicted of things like this, then that person cannot work either. Okay, and when I first started talking, I was told you about that none of the codes, none of the codes are waivable. Before 2010, we had where if you were convicted of murder, the code could have been waived and you could have worked if the person that you were working with signed off. But now none of the codes can be waived. If you were working before 2010 and you did not seek reemployment after 2010, then you would be able to work. But if you have that break in service, then you would not be able to work, because you would have to abide by the rules that we have now. Okay, we were talking, and like I said, we were talking about background checks and screening. Background, we have our background checks that are done for our non-licensed personnel upon hire. And we have our adverse action site that you go to monthly to look at that, and you have to go to the CNA registry also and look at that to screen these employees. Thank you.
Thank you, Mary. All right, so for nursing facility license requirements, we'll briefly cover that as well. So as Mary indicated, yes, everyone in your facility should have a criminal history check performed, especially on your non-licensed personnel. That includes CNAs, housekeeping, activity workers, social service personnel, and other non-licensed personnel who provides care or other healthcare related services to residents in your facility in accordance with revised statute 40:1203. Okay, our regulations hadn't been updated to make that change from 40:1300.51 to 40:1203. Also, all personnel requiring licensure to provide care in your facility shall be currently licensed to practice in the state of Louisiana. Credentials of all licensed full-time, part-time, and consultant personnel shall be verified on an annual basis in writing by a designated staff member. So with that being said, if you have a CNA who comes from a different state and she works for an agency staff, she needs to be vetted by Louisiana. She needs to follow the requirements, make sure she's received reciprocity to work in Louisiana before working in your facility, including nurses as well. All right, federal requirements for long-term care facilities. So FTAG 606, not to employ staff with adverse actions. So the facility must not employ any individuals who have been found guilty of abuse, neglect, exploitation, misappropriation of residents' property, or mistreatment by a court of law. That means they've been convicted, or they have had a finding entered into the state nurse aid registry concerning abuse, neglect, exploitation, mistreatment of residents, or misappropriation of their property, or they have a disciplinary action in effect against his or her professional license by a state licensure body as a result of a finding of abuse, neglect, exploitation, mistreatment of residents, or misappropriation of residents' property. So as Mary stated earlier, once you have the results of the criminal background check, if the disposition is blank, you need to make sure you find out exactly what the findings of that charge was. Were they convicted or were the charges dismissed? You just can't have these folks working there and there's no disposition. Okay. The facility also must report to the state nurse aid registry or licensing authorities any knowledge it has of any actions by a court of law against any employee, which would indicate unfitness for service. So for the purpose of this webinar training, staff includes employees, the medical director, consultants, contractors, volunteers, any caregiver who provides care and services to the resident on behalf of the facility, students in the facility's nurse aid training program or any other academic institution, also including like your therapy departments, your social service departments, and your activities department. So the facilities must be thorough when investigating the history of a prospective staff member. In addition to querying the state nurse aid registry or the licensing boards, the facility should check previous employers or even current employers' before making a reasonable effort to hire these folks. Okay, that way you find out if there's any type of criminal past or criminal prosecutions against these individuals. But just so you know, it's been reported that former nurse aides with findings of abuse, neglect, misappropriation of residents' property, or mistreatment, they may seek employment in other departments of the facility, such as maintenance, laundry services, etc., in another area where it's a non-nursing capacity. It's at F607, developing and implementing abuse and neglect policies. So nursing homes must develop and implement written policies and procedures to prohibit abuse, neglect, exploitation of resident, and misappropriation of residents' property that contains the following components: screening, training, prevention, identification, investigation, protection, reporting, and the new one is coordination with COOP. So for the purpose of this webinar, we're going to focus on screening. So the screening must be done prior to hire, prior to employment. And that includes attempting to obtain information from previous employers or current employers, and checking with the appropriate licensing boards and registries. And if you need additional information on that, reference FTAG 729 from the federal requirements related to registry verification and multi-state registry verification. Also, the screening, it can be conducted by the facility itself, third-party agency, or the academic institutions. What you need to make sure is that the facility should maintain documentation of the screening that has occurred. Your policy should also address, I'm sorry, can you mute your mic, please? Your policy must also address how pre-screening occurs for prospective consultants, contract or temporary agency staff, volunteers, caregivers, and students in the nurse aid training program, and students affiliated with another academic institution. Again, including your therapy department, social services, and activities department. Nurse staff agency requirements. I'm just going to be real brief with this one. It was enacted through the 2022 legislation that Act 577 now authorizes the Department of Health to regulate and provide licensure to nurse staff agencies, which was promulgated in October of 2023. The biggest takeaway from this piece is that all nurse staff agency providers shall be licensed by the Louisiana Department of Health. So if you contract with a nurse staff agency, you need to make sure that they are licensed by the Department of Health. And I forgot to mention on the last webinar, you can go and visit the Health Standards website, nurse staff agency webpage, and find a list of all those agencies who so far has been licensed. If there's an agency you do contract with and they're not on there, please give the program manager a call to verify, because he's still onboarding those agencies. Also, just like any provider, those NSAs should not employ or sign or refer to any healthcare provider in Louisiana, a nurse or CNA, unless they've been vetted through Louisiana and have complied with the state and federal laws and regulations that meet the mandatory qualifications and requirements. Okay, so revised statute, this is the same one, the 40:1203. The businesses shall send, and I'm talking specifically the nurse staffing agencies, shall send accompanying letters certifying that the contracted staff meet license and certification standards of their profession and have undergone and passed the background checks. Okay. So per the statutes, it real important, nursing home providers should have a certified letter from the staffing agency for surveyors to review upon survey for the contracted entity. Ultimately, it is the responsibility of the nursing home provider to ensure staff has had criminal background screenings and are eligible to provide resident care. All right. And if you have any inquiries about nurse staff agency, you can send your inquiry to this web address. I'm sorry, to this email address. Michael Meir, he is the sitting program manager for the nurse staffing agency. All right, and here's a list of resources that we've kind of compiled for you. So you can visit the health standards directory, and you can, through the directory, you can go find the criminal background webpage. You could also visit the nursing home webpage for the minimum licensing standards, the nurse staff webpage for the nurse staff agency licensing standards, the CNA DSW registry for those regulatory requirements, the state operations manual, and last but not least, the Louisiana State Legislature website. Okay,